Do you know if the depression is a common mental disorder and one of the main causes of disability worldwide? And globally, an estimated 264 million people are affected by depression. And now, we are going to talk about it. What depression is, what the symptoms are, and how to treat it. Depression is a common and serious medical illness by feeling prolonged and persistent periods of extreme sadness that negatively affects how you feel, the way you think, and how you act. Depression can affect everyone, no matter what gender you are, how old you are, what your job is, or what background you have. Everyone can experience this mental disorder. There are so many factors that can play a role in depression. First is biochemistry. Differences in certain chemicals in the brain may contribute to symptoms of depression. And then is genetics. Depression can run in families. For example, if one identical twin has depression, the other has 70% chance of having the illness sometime in life. And next is personality. People with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic appear to be more likely to experience depression. And last is environmental factors. Continuous exposure to violence, neglect, abuse, or poverty might make some people more vulnerable to depression. And depression that is left continued and doesn't get the right treatments can lead to decreasing of productivity work, disturbing social relationship, and the worst is can lead to suicide. Thus, knowing about mental disorders, especially depression that we have talked before, is important. Now, let's talk about the symptoms. According to the American Psychiatric Association, depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once you enjoyed, changes in appetite or weight loss, or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, feeling worthless or guilty, difficulty thinking, concentrating, or making decisions, and severe is thought of death or suicide. So, how can you distinguish your usual sad feeling with depression? Getting the lower grade in the class, the death of a loved one, loss of a job, or the ending of a relationship are difficult experiences for a person to endure. It is normal for feelings of sadness or grief to develop in response to such situations. The grieving process is natural and unique to each individual and shares some of the same features of depression, but these are the differences between two of them. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased, but in major depression, mood or interest are decreased for most of 2 weeks. In grief, self-esteem is usually maintained, but in major depressions, feelings of worthlessness and self-loathing are common. In grief, thoughts of death might surface when thinking of or fantasizing about joining the deceased loved one, but in major depression, thoughts are focused on ending one's life due to feeling worthless or undeserving of living, or being unable to cope with the pain of the depression. So, if you recognize the symptom in yourself, then you should go to get a treatment. Depression is a real illness and help is available. With proper diagnosis and treatment, the vast majority of people with depression will overcome it. And the simple way to treat depression is to start talking. For a person who is experiencing it, don't be afraid to talk about what you have experienced. Many people who have mental disorder do not want to talk about it, but mental disorder is nothing to be ashamed of. It is a medical condition, just like heart disease or diabetes, and mental health conditions are treatable. Find the right person you can share with. It could be your friends, your siblings, or your parents. Feel free to share your experience. And for the friends or whoever, be aware of your surrounding. Look at your beloved person, look at your friends, look at your family. If you find the symptoms in them, start to talk with them, listen to them. It doesn't matter whether you can give solution or not. You don't need to fix things. You just have to show up, showing that you are there for them. Show that they are not alone. Give them your empathy. Tell them that they are precious, because this kind of person is so easily lost of sight how valuable they are. And don't ever to think that depression is a simple problem that they can snap it easily. No, it is not that easy. If they can, they will do it immediately. Does not drag on in sadness like that. Just take a seat, having courageous talk, listen to them, so you are there for them. And last and the best suggestion you can give is to recommend them to go to the professional. Yep, because the effective treatment for mild to moderate depression is by talking therapies, such as cognitive behavioral therapy or psychotherapy. I'm truly feel sad by people who experience depression or other mental disorder, but they are afraid to visit psychiatric because of the stigma that is still grow in this modern era, saying that person who come to the psychiatric is a crazy. Of course they will afraid of the judgmental. They are afraid of being isolated. So what they can do is just keep silent. Now, we are in the era that mental health issues should be more get attention. We have to silence the stigma. We have to silence the judgment. And then, the next treatment is using antidepressants. Brain chemistry might contribute to an individual's depression and might factor into their treatment. For this reason, antidepressants might be used to help modify one's brain chemistry. Antidepressants can be an effective form of treatment for moderate to severe depression, but are not the first line of treatment for cases of mild depression. They should not be used for treating depression in children and are not the first line of treatment in adolescents, among whom they should be used with caution. And next is electroconvulsive therapy or ECT. ECT is a medical treatment that has been most commonly reserved for patients with severe major depression who haven't responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. ECT has been used since the 1940s, and many years of research have led to major improvements and the recognition of its effectiveness as a mainstream rather than a last resort treatment. Besides that, self-help and support can also be very important to an individual's coping, recovery, and well-being. Lifestyle changes such as good nutrition, exercise, and adequate sleep can support mental health and recovery. A comprehensive treatment plan might include individual actions, for example, lifestyle changes, support groups, or exercise that enhance recovery and well-being. That is all about the depression. Now you know what the depression is and what the symptoms are. Please check yourself. Identify the symptom in yourself. Do you feel the same? If not, like you, but perhaps you should anticipate it. And if you can feel the same symptoms, please speak out and get the treatment. Talk to your relation first. Share your story with them. And if you feel the same, still doesn't get better, then you should not refusing to go to the professional. The evaluation will identify specific symptoms and explore medical and family histories as well as cultural and environmental factors with the goal of arriving at a diagnosis and planning a course of action. So you will get both what you need and the right treatment. Whether you will get talk therapy, antidepressants, or ECT. Now, be aware of yourself. Pay attention of your health, not only physical health but also mental health, because everyone has mental health, so it should be treated very well. Thank you.